Body temperature is controlled by a brain center called hypothalamus. This center balances heat production and dissipation to maintain normal body temperature. I'll show you how that works in a minute. In the last episode, we spoke about the best way to measure child's temperature, and we defined the range of fever. But today's question, how can I control my child's fever? Muscle fibers are in continuous contraction and relaxation even if we are not moving. It's called muscle tone. This continuous action is to maintain our posture, and the end result of muscle movement is heat production. Our liver, which take care of most of the chemical reactions in our body, produce heat also. In contrast, our skin dissipates heat through sweating in a mechanism called convection, which means, in a simplified way, reducing body temperature by evaporating sweat. Breathing also dissipates heat. Take a deep breath in a cold room and then blow it and feel how the air coming from your mouth is warm. As we mentioned earlier, there is a brain center called hypothalamus. It controls our body temperature through the aforementioned heat producers and dissipators. This brain center is able to maintain fairly steady body temperature in normal temperature environments. However, at environmental temperature higher than 35 degrees, the body ability to dissipate heat is overwhelmed and the core temperature of the body will start to rise. In the hypothalamus, there is a set point for targeted body temperature. The body will always aim to keep the core temperature at that set point. This is how it works. If you are in a hot place and your core temperature is rising, the hypothalamus will ask the lungs to breathe faster and the skin to produce sweat in order to reduce your body temperature, aiming to reach that set point. If you are in a cold area and your core temperature is dropping, the hypothalamus will ask the muscles to increase its tone to produce heat. And that's why we experience shivering in cold areas. This way, our muscles will produce heat, increasing our body temperature to reach the targeted set point. Germs can affect our set points. Let's take this important example. Let's say our body was attacked by a germ, which changed the set point of the hypothalamus from 37 degrees, which is the normal temperature, to 39 degrees. Now the aim of the hypothalamus is to increase the core temperature to reach 39 degrees. The body will start shivering to produce more heat in order to reach that targeted temperature. So that's why we shiver during fever. If we want to explain the normal function of our brain and temperature management, I think we need a separate episode. That was a brief idea. Now let's look at how to control your child's fever. We said in the previous episode, fever is considered as 37.8 degrees and above. I know fever is frustrating to parents, but we should know that it's a normal response to infections and it's a part of defense mechanism. Before talking about medications, I should mention that keep in your mind our aim in reducing temperature is to relieve the child, nothing else. Focus on your child's mood after fever medication and never be obsessed about numbers. The first medication of choice is paracetamol. It has less side effects, but it's not allowed in 3 cases. Number 1, if the child is allergic to paracetamol, which is really rare. Number 2, if the child has liver disease, because paracetamol is processed in the liver. Number 3, if the child is less than 3 months of age and fever was the only symptom, because fever can be the only sign of serious infection. So it's advisable not to start paracetamol in children below 3 months of age until the child is examined by a doctor, at least to rule out any serious infection. Paracetamol starts to work in 30 to 60 minutes and its effect lasts 4 to 6 hours. Out of 10 children treated with paracetamol to reduce their temperature, 8 will experience reduction by 1 to 2 degrees. The minimum gap between 2 doses of paracetamol is 4 hours. I'll explain the proper way of calculating dosage in the next episode. Ibuprofen is the second medication of choice. Never say, my child doesn't respond to paracetamol, that's why I'll start by ibuprofen. Always give paracetamol a chance. Ibuprofen is also considered safe for children above 6 months of age if given at appropriate dosing and taken after food. Ibuprofen starts to work in less than 60 minutes and it lasts 6 to 8 hours. The minimum gap between 2 doses of ibuprofen is 6 hours. Ibuprofen can affect kidneys, so it's not allowed to be used with children complaining of kidney diseases. There is a strategy to control fever and child discomfort by combining the two medications as follows. And before that, I suggest using this strategy only if one of the medications alone didn't do the job for you. Start by giving paracetamol, but prior to that, make sure the child is irritated and there is fever. After 4 hours, use ibuprofen, and again prior to medication administration, make sure there is a reason, which means there is fever. Again after 4 hours, go back to paracetamol and go on this way as long as the child is in need. This way, you are keeping a gap of 8 hours between 2 doses of the same medication, which should keep the child safe. Have a look at this demonstration to make it clear. The last way I'm gonna mention is external cooling, like showering your child or applying cold pads. We don't advise this way to reduce temperature because it increases the child discomfort, plus the effect is really short. The set point in the brain is still high, and again the brain will aim to increase the body temperature to that set point, which will make the external cooling inefficient. If you really need to use external cooling because medications are not working for your child, make sure to do it half an hour after fever medicine administration. This way, the set point will go down and the external cooling will help decreasing the temperature faster. If you like the content of this episode, make sure to like and subscribe, and if you have any questions, leave it in the comments. Keep watching my channel to keep your children safe.